Hi, so it's your boy Abraham. So today I'm going to talk about anti-diabetics. So first of all, we have to understand what is diabetes. So diabetes is basically the metabolic condition characterized by hyperglycemia. So hyperglycemia is basically increased high levels of glucose in the blood. So we have, and then people sometimes wonder why it's called uh, DM, diabetic mellitus. So mellitus comes from a Latin word, mel, MEL, which means sweet or honey. So it's because of the urine of the diabetic patients were found to be sweet. That's why it was named that. So we have different types of diabetes. So we have type 1. So this is basically due to autoimmune disease. So we know that the function of the immunity is to provide is to provide protection. So instead, the immune system releases antibodies which targets the isolate of Langerhans, specifically on the B cells. B cells are responsible for production of insulin, and then A cells glucagon. So as a result, there's no production of insulin in type 1 diabetes. So we give what we call exogenous insulin. So insulin which is manufactured to supplement. So type 2 diabetics, basically this usually is caused due to what you call insulin resistance or low production of insulin. So you can find that insulin is there, but because of a number of factors. And according to literature, if I'm wrong, I may be corrected, but I read a few years ago, almost 80% of patients who are diagnosed with type 2 diabetes are obese at diagnosis. So meaning, especially the fatty belly, we have to be very careful. Fatty belly, if it accumulates, it can cause insulin resistance. And in simple terms, we have to understand the role of insulin. So this is a hormone responsible basically for uptake of glucose from the bloodstream to tissues, muscles, to the liver. You know, the liver stores glucose in terms of glycogen. So if you go briefly in biochemists, if can you quickly revise about glycolysis. So this, you know that this is a process which involves the metabolism of glucose to form pyruvate, lactic acid. So pyruvate, end product of glycolysis. So insulin causes the uptake. So there are a number of processes, but in simple terms, and also the storage of, yeah. So in type 2, basically there's insulin, it could be there but it's not functioning, or it could be caused by low production. And also there are what we call predisposing factors, very important. So predisposing factors to type 2 diabetes. So obesity, yeah. So sedentary lifestyle, so living without exercising, and other factors. Yeah, so especially obesity. So we have to be very careful. So I'll one day prepare a video on obesity. Yeah, so we also have what we call gestational diabetes. So gestational diabetes, diabetes in pregnancy. The pregnancy itself can cause diabetes. So I won't go in details. It will be for another day. Yes, and there are other types. So mainly today I want to talk about anti-diabetics. So the first crisis is sulfonylureas. So examples, we have glipizide, also known as glibenclamide, glimepiride, chlorpromazide, tolazamide. Yes, so this basically sulfonylureas This basically sulfonylureas, how they work. I want to briefly explain. It's very important, especially for pharmacy students, even doctors. Necessarily, you often understand how this drug work. You you appreciate. So sulfonylureas. So they work B cells in the pancreas. So we have to understand so I think I'll have to prepare a video on mechanism of action in details, but basically it involves action potential. So there is a so they bind at sulfonylurea receptors. So they bind at sulfonylurea receptors, and then leading to the blockage of ATP sensitive channels. So as a result, this will cause action potential, causing the release of insulin, and then insulin now praise laws. So the other group is biguanide, a very common group. So I think that currently the only drug which we are using is metformin, and this basically causes what we call tissue sensitivity. It increases tissue sensitivity towards insulin and also inhibit gluconeogenesis. Yes, very important. And they say the exact mechanism of biguanide is unknown, but these are, possible mechanisms. So this is commonly used in people who present with diabetes or are obese. For one reason, metformin does not cause weight gain. Yes, sulfonylureas, they cause weight gain. So this is very important, metformin. And usually they start at 500 milligram. 40 milligram OD or BD increases. They give up to 2,000 milligram to 2,500. Yes, depending on the severity. And also the third group is thiazolidinones, TZD. So in America, Z we call it Z. So examples are thiogritazones, examples are pioglitazone, losgritazone. So they are common known as glitazones. So this basically they inhibit they actually activate what you call peroxisomal profilator activated receptor. So I'll just abbreviate it. PPPR. So these receptors are involved in glucose and lipid metabolism. So this will lead to improvement of insulin sensitivity in peripheral tissues and muscles. So the other group which I would like to talk is alpha glucosidase. Examples are alpha glucosidase inhibitors. We've got acarbose, migrito. So this basically their mechanism of action, they inhibit the activity of this enzyme, alpha glucosidase enzyme. Yeah, as a result, so this enzyme is found in the intestine. So this will basically will slow the digestion and the absorption of carbohydrates, which will increase what we call postprandial glucose levels. So after eating. Yeah, so let us also move to other groups quickly. Yeah, so the fifth group, they are called the peptidase. So dipeptidase peptidase inhibitors. So examples are sitagriptin, saxagriptine. Yeah, so this how they work. They inhibit the activity of alpha. They inhibit the degradation of incretin hormones such as GPL1 and GPL, leading to stimulation of insulin secretion and inhibition of glucagon release. Yes, those that will reduce. So I'll go in details in the next videos. And then the last group is this is very interesting. I love this drug. It's called this group of drugs are called sodium. They're called sodium glucose cotransporter inhibitors. Sodium glucose cotransport inhibitors. So examples, these are new drugs: empagliflozin, canagliflozin, dapagliflozin. So I have seen this drug is very good. So on how it works, so basically physiologically we have to understand that in the renal proximal tubes, renal proximal tubes, there is a transporter called the sodium glucose cotransporter, so abbreviated as SGLT2. So this it causes this is primarily of this transporter. It reabsorbs glucose and reduces urinary glucose excretion. So it reabsorbs glucose and reduces urinary glucose excretion. So this drug now they inhibit the function of this cotransporter. As a result, there's increased urinary glucose excretion and a reduced glucose reabsorption. Yes, so next video I'll talk about insulin, mechanism of action of these drugs, and lastly I would like to talk the micro and macro complication of diabetics. So this usually occurs in type 2 diabetes. So micro complication basically are those complications which affect the small blood vessels, I think. So like retinopathy, nephropathy, and then macro we have heart diseases or cardiovascular diseases like ischemic heart diseases, cerebral, stroke, and yes. So thank you so much. Bye bye. Have a good one.